Living with a stuffed nose may be an everyday part of your life, but it doesn't have to be. Today we're learning about why congestion happens and how you can treat it. And joining me now is sinus surgeon Dr. Amy Anstead from ProLiant Surgeons Puget Sound ENT. Thank you for being here.
Thank you for having me. I'm so excited to be here to try to help people learn how they don't have to live with a stuffy nose.
We don't have to live like this.
You don't have to live like this. We have a solution.
Yay. And so for those that aren't sure what a rhinologist does, can you explain what they do?
Sure. So rhinologist is a subspecialty within ENT. So there's ear, nose, and throat surgeons where we learn how to do all different types of surgeries in the head and neck. So everything from thyroid to throat to ears. But then there's a subset of people that go on to do a specialized fellowship in rhinology and endoscopic skull-base surgery. So we learn how to do everything from getting you breathing better through your nose, to curing chronic sinus infections, to taking brain tumors out through your nose. And so I'm the only rhinologist in private practice in the Seattle area. And so I'm a resource here for everybody so that if you cannot breathe through your nose, you need to come in so we can fix that.
Definitely.
Not a way you need to live.
So what kind of patients do you see? Is it anything from I'm snoring to what?
Absolutely. So I see everything from I just can't breathe well through my nose to I have a horrible life-threatening sinus infection that's causing asthma and I'm getting admitted to the hospital for pneumonia and bronchitis and things like that. We can actually reverse adult onset asthma. So when people get adult onset asthma, they think, oh, I just have to live like this for the rest of my life. If that is not true, if it's driven by chronic sinus disease, we can actually reverse it. And so it breaks my heart to see people living 10, 15, 20 years with debilitating disease, not realizing that there's a solution. And so if you can't breathe through your nose or you're having difficulty breathing, please come in and see us.
Definitely. And you touched on this, but I want to get to understanding your training and how unique that is when it comes to treating patients.
And so not only did I do a fellowship in rhinology and endoscopic skull-base surgery, but I also did a second fellowship in integrative medicine. And so integrative medicine, Andrew Weil is kind of the leader, Dr. Weil, and he's at the University of Arizona. So I spent 2 years with him learning about integrative medicine. And then I also trained with the Institute for Functional Medicine, and I'm a certified practitioner with them. And so I have kind of this very broad range of training so I can kind of look at you from multiple different perspectives so that we can actually get you back to wellness. And that's really our goal, is to get you to be well again.
Yeah. Wow, you were the person to know for sure. Yeah. You brought a nose model in. Nose model. I love it. Yeah. Show us what causes congestion and more.
Absolutely. So the nose, people don't really think about, like what's going on in their nose and why are they congested. And so one of a common cause is the septum. And so in the middle of your nose, there's a wall and it separates right and left. And it's really common for the septum to be deviated or for it to tilt to one side. And so people often notice, like, I always have to sleep on my right side because my left side gets congested. And that's very common. The septum is deviated and so it gets blocked up. And so those people, we can fix that. It's like there's a solution to that. And then also there's these things here called inferior turbinates. Inferior turbinates, it kind of looks like a little hot dog inside of your nose. And so if people look up their nose with like a flashlight, there's like, oh my gosh, there's a tumor in my nose. Not a tumor, it's just a little inferior turbinate. It's a normal structure inside of your nose. But that's the guy that gets swollen up when you get allergies. So this time of year, everybody is stuffy and they have runny nose and they're kind of miserable with everything blooming. And that's because of this inferior turbinate. And so we brought some nasal sprays.
Please tell me.
And so the nasal sprays affect the inferior turbinate. And the one that you probably hear the most commonly is Afrin, right? Mm-hmm. And so doctors have a love-hate relationship with Afrin because people become addicted to Afrin. And so once you start using it, you can only really use it for 3 days. And so it's a vasoconstrictor. That's the mechanism of action. And so your inferior turbinate will shrink up and you'll get this instant relief where you can breathe again, which is fabulous. But after 3 or 4 days, it doesn't really work as well, and you're needing more and more medicine, and the turbinate is kind of growing slowly and getting bigger and bigger and bigger, and so your problem's actually getting worse and worse and worse.
Oh no.
Yeah, so Afrin is great, but only for 3 days, so if you use it, please throw it away after 3 days so you're not tempted. Yeah, sparingly. And so there are other nasal sprays that are a little bit safer to use, and those are the topical nasal steroids. And they come in a couple different varieties. And so there's Flonase, there's Nasonex, and so you can see these at your over-the-counter pharmacy. And they work a little bit different because they're topical nasal steroids, and they basically bring the inflammation down in your nose. And so if you're having allergy and your nose is very inflamed, you can do a couple sprays of this, and over time, it will slowly bring down the inflammation. So it's not an instant relief, and so people are like, oh, I really like my Afrin because it's instant. It kind of slowly works over time, but it's safer. Okay.
We like that.
So that's the nasal steroids. And then another nasal spray is called azolastine, or the Astepro is one of the brand names. And so this one is actually a topical antihistamine. And so a lot of people take like Benadryl or Allegra, or those types of oral antihistamines. This is a topical antihistamine. So if you're having like sneezing, itching, runny nose with the allergies, then this might be your choice.
Amazing. You are so full of information. I loved this segment. Thank you for being here.
My pleasure. Thank you for having me.
For more information and to find a doctor, just visit the website that you see right there on your screen.
New Day Northwest is sponsored by ProLion Surgeons Puget Sound ENT.